Hi, I'm Elizabeth Martin. I'm a pediatrician at Starling Pediatrics, and I'm talking to you today about COVID vaccines for children. Right now, the Pfizer vaccine is available for 12 years and older. I vaccinated my 12-year-old the very first day. The very low risk of serious complications is far outweighed by the risks of getting COVID and complications from COVID. Millions of US children have had COVID. Some have significant symptoms, some even require hospital care. Our local children's hospital has active cases right now. It's more serious than a cold or a flu. They can get serious complications. Hundreds of children in the United States have died of COVID, and the children can spread it to their friends, their family, and vulnerable community members. Annually, influenza causes about 100 to 200 pediatric deaths in the US. Despite all of our precautions in this past year, COVID has killed 300 to 400 children. This is considerably worse than most flu seasons that we see. COVID is not just the flu. It's much more serious for adults and for children. We get a lot of questions about breastfeeding moms, and all of the professional societies agree that breastfeeding should not be disrupted for COVID vaccination and that healthy mamas are essential for healthy babies. We encourage getting the vaccine. We recommend continuing to mask and wash hands, avoid unnecessary gatherings, especially if they're indoors. If your child has an exposure, you should keep them as isolated as possible and call your doctor for advice. There's a 7 to 14 day quarantine period that's usually recommended. So we do same-day rapid COVID testing with a PCR test in our office. It takes about an hour for results, and most places accept those results. And it's just as accurate as the send-out PCR that we send to our lab. We offer it for all of our patients, and we encourage testing 5 days after a known exposure or sooner for any symptoms or concerns. For children, with COVID, we commonly see that they'll have runny nose, cough, congestion. They appear very much like a common cold, especially with the Delta variant that we're seeing more of these days. So even if the illness seems minor, it's still important to do your due diligence and call your doctor. I got my COVID vaccine the first day it was available, and I was thrilled to do it. My family was very relieved. I gave my husband his Moderna vaccine at a Starling clinic, and his second dose too. He said it was the best present I ever gave him, aside from our children. I vaccinated my 12-year-old the very first day, about an hour after the CDC said that we could. Currently, our office is vaccinating any member of the community, 12 years and older. You don't have to be our patient. You don't even have to live around here. You just call our office number and we'll book you in and get you in one of our slots.